Haldimand Physio. We're going to talk today about what to expect with your acupuncture treatments. So first of all, before you come in, if you can make sure that you've eaten something, that just helps to stabilize your blood sugars so that you feel comfortable during the treatment. As well, if you can think about what kind of clothing to wear, something a little bit loose that's mobile that you can pull up to have the different areas treated. So each visit with the acupuncture, it's important to know that we're using sterile needles for one-time use. So we've only used them with you, and they come in sealed containers. So what you should expect with needling is a little bit of pressure from the tube before we insert the needle. That just helps to desensitize the tissue. What you're going to also feel is a palpation of the therapist's hands to figure out where the needle is most appropriate. What you're going to feel or experience with the acupuncture needles is a sensation of a little bit of pressure, maybe an ache, a dull prick, but nothing sharp like having blood drawn from the doctor. You're going to feel the compression of the tube, which just helps us to desensitize the tissue before the needle is inserted. So it's important that you're comfortable in the position you're in, because once the needles are in, you're not going to be able to move. So here we are ready to go. We're going to just feel the different tissues in the back to decide where the needles are going to go. And from here, again, you're going to feel the tube. You're going to feel a little tap. And then you're going to feel a little bit of insertion, or maybe nothing at all, as the needle goes in. And there we go. We have our first needle. With this, the patient should be comfortable. You should feel relaxed as the treatment needles are left in. And what we do after they are in is most of the time we hook up a stimulator to that. That just helps to provide a little bit more feedback to the tissue to give you a different type of sensation and response to the treatment. Once the needles are inserted, we hook on the stimulator. The patient will experience a sensation of a tapping that is comfortable. Then we leave the needles on for about 10 to 15 minutes so they can get the most therapeutic benefit out of the treatment. Once the treatment is completed, the therapist will remove the stimulator and the needles. The patient may feel a little bit of achiness, or they may feel nothing at all and actually feel quite relaxed after the treatment. Once the needles have been removed, the patient is able to resume any activities that they have that day. I hope that this answered some of your questions about what to expect, and we look forward to treating you at Haldimand Physio.